welcome back to another episode of Living to 120 and Beyond. I'm Jeff Harrison. I'm here with
Dr. Edmund Chein.
And we get to talk, or I get the benefit of talking to Dr. Chein, who is one of the leading doctors in longevity. In fact, you're known as the doctor of longevity, father of longevity.
Yes.
And you've done some things that are pretty amazing when it comes to helping us do what we're supposed to live longer. Would you mind taking just a moment and just, for those people that might be just jumping in, they don't know the story, give us that Reader's Digest, if you will, of, hey, your story of when you were back at USC Medical School and you decided, you're going to make aging and as a disease.
Yeah.
And really attack this a different way. Would you mind taking just a second and talking about that?
Actually, the title is more appropriate by calling me father of HGH.
Oh.
And not longevity.
Okay.
It's HGH because I was the first one in the USA to use growth hormone HGH on adults. At that time, it was a crime. Still, it's on the books as a felony, but I won in the federal court and even have the California state judge declare that use of growth hormone for anti-aging is scientific. So now, basically, any doctor after me can, if Chein can do it, I can do it. This is America. This is equal protection before the law. So basically, that way I became a father of HGH, and we can use growth hormone for anti-aging now. But when I started years ago, when at SC my job was to find out why do we age, and we age. We know that we knew at that time already that the telomere in the DNA has something to do with it. When it gets long, a person lives long. When it's short, a person has a short life expectancy. And by the way, this is the newest thing this month. Telomere length test was expensive. It was $650 last month. This month, $89.
Whoa!
Yes, a new company from Menlo Park came out with a test at $89.
Wow!
So lucky to all of us, me included. I already paid for it yesterday. I ordered the test kit. You ordered the test kit, do it at home, and then send it in. I think it's a finger stick blood test.
Yes. That's fabulous.
It's fabulous because now you can do a telomere test on yourself, see how old biologically you are, as compared to your chronological age on your birth certificate. So basically, my scientific question at that time was, well, the DNA is right inside of a nucleus or a cell. How does it know how old I am? There must be a spy. There must be a tipper tipping that DNA off. Well, who is tipping it? What is tipping it? And it turns out to be hormones, all the hormones, and the hormones give is the one that attaches the cell surface and gives the RNA message to the telomerase, which is the engineer, keeps repairing the telomere. So when our hormone levels drop, the telomerase go to sleep, vacation, and the telomere gets shorter and shorter. No repair,
okay.
Nobody to lengthen it.
Okay.
And so that's why, subsequently, long story short, is that hormones turn out to be. That's how I got my patent. Is that hormones can change lifespan by affecting the telomere or the telomerase, and that's why I advocated that. I took that as a specialty, and now all I do is supplementing hormones, nutrients, because when you supplement hormones, the cells grow, they regenerate, and they regenerate, you need new materials. If I have you build a new house every day, you will need a lot of bricks and cement right. And 4x4s, right?
Right.
So same things. When you regenerate to be useful, you need all the vitamins like a little kid.
Oh, okay.
All the nutrients, vitamins, minerals, amino acids, essential fatty acids, and vitamin D and vitamin K, these things.
So if somebody's just doing hormone replacement,
no,
they're creating this massive deficiency, and as you say,
it'll fail.
You
can hire the best architect, the best contractor, But I say, oh, no, there's no brick available, no 4x4 available, no cement. You can't build a house,
Yeah.
even with the best architect and best
Ah,
contractor.
interesting. Okay.
Yeah, yeah.
I love it because Dr. Chein gives me these little stories all the time, and this is a new one, so I love that. I didn't
Yeah.
realize that. That's
Yeah.
excellent. So
It makes sense, doesn't
that
it?
makes total sense.
Yeah.
Absolutely.
It's dumb as cement. If you don't have it, you can't build a house.
Yeah.
You know, so.
So with this, I mean, you did a lot of things. Like you said, you got the patent. You were the first one through that treating hormone levels adds to the longevity or the
Yes.
life of the telomere. You were actually able, if I'm not mistaken, you were actually able to reverse the length of the telomere. Were you
Right,
not?
from short to long, yes.
So with this test you just you talked about, let's say for instance a year ago, if I would have had that test, which I did, but if I had that test and let's say it said I'm 60 years old, okay, but then I supplemented it the way you recommend for a year, and I tested again, I could
could be
now
50.
it could be 50. My telomere could be longer. So that's saying, hey, internally, my body now is that of a 50-year-old, not a 60-year-old.
Yes.
Which means I should now have the stamina, the energy, maybe the concentration, the focus of a 50-year-old versus a 60.
Right, correct.
I like that.
You know, I have a reward on the website, $25,000 for anybody who can show me a difference between their DNA telomere age of more than 27 years. Okay, birth date on the birth certificate and DNA telomere age more than 27 years, I get them 25,000. And it's been tried like, over the last few years. Nobody won it, yeah. But I think that not as many, probably a little over 100, I think, people. And I think because the cost of the telomere test is $650.
Yeah.
Now that with the added test of 89, I may see thousands of people trying to get at 25,000.
That's funny.
Because it's so cheap.
Yeah,
you know.
we might have to throw down a bigger gauntlet.
Yeah.
Well, you know, with this, we're talking about, you know, things changing. You're talking about medication,
Yes.
medicines changing, and science changing. There's a new drug that you've been talking, or excuse me, not a drug, a new supplement, a new
Yes.
vitamin you've been talking about that you started introducing back in November of 2015.
Yes.
And it's called K2. Now, I've never heard of K2
Yeah.
until you mentioned it.
Yeah.
Tell us what it is, why it's so important, and what we can see as far as a benefit is concerned.
Okay, K2 was not didn't have anybody pay that attention to it other than clotting. Okay.
Okay.
K2 is involving clotting, and when people have a stroke or venous thrombosis, doctor put on anticoagulant, and when they overdose it. When they overdose the anticoagulant, when patients swallow a little more than they need to, the antidote is K. Okay, vitamin K is the antidote for anticoagulant. However, it was in this group of patients on anticoagulation that K got its fame and found its miracle. What happened was that in people on anticoagulation, and sometimes they're on it for venous thrombosis for 20, 30 years on warfarin. I don't know if you've heard about it. Okay,
Sure.
on warfarin, just daily. Okay, to maintain it, prevent clotting. People with stroke too take warfarin daily. Okay, they found that warfarin has a side effect, and the side effect's severe osteoporosis.
Oh boy.
Okay, and that osteoporosis is so severe that they have a fracture as a result of being on anticoagulation therapy. So they started using vitamin K to try to see if they can lower down the bleeding time, you know, make it shorter, so that the patient get a little bit of benefit of anticoagulation rather than a lot in a safety zone. Well, when they give them K2, they reverse the osteoporosis.
Oh boy.
And one smart doctor, a group of doctors in Japan, decided to stop the anticoagulation completely, give that group patient vitamin K, 87% is controlled compared to the control group. Wow. Didn't have fracture.
Wow.
Everybody got osteoporosis, but this group that this experimental group reversed their osteoporosis, and 80% don't have fracture as compared to the control group that has fracture.
Wow.
So much so that Japan now make it a approved D as an approved treatment for osteoporosis, not USA. So meaning that if you're osteoporotic and I prescribe you vitamin K, your insurance won't pay for it. Blue Cross Blue Shield won't pay for it in this country. In Japan, I prescribe vitamin K, the insurance company pays for it.
Wow.
It's a approved use. So that's how vitamin K got its name. Then also in this group, same group of people, they found that the, people on anticoagulation have accelerated arteriosclerosis, plaques forming on their arteries, okay, which we call arteriosclerosis.
Okay.
And then when you give them K2, that plaque goes away.
Oh, wow.
Since when have we heard plaques going away?
Yeah.
I mean, that's like if I can sell a pill that will remove plaques, I probably can you know, if I can advertise that, I can sell it for $20, $30 a pill, you know.
Yeah.
But no, it's just simple vitamin K can remove these poor coagulated patients. Their plaques can be removed. So then they tried it on normal people.
Well, that was my next question is,
Yeah.
what about us healthy
Yeah, healthy people.
yeah.
Not on the same thing. The plaques go away.
I'll be darned.
Yeah. So now K becomes because that's removing. If you can remove the plaques in your arteries, that's one of the major causes of death: stroke, stroke, heart attack, both.
Yeah.
Clotting of the arteries, right?
Yeah.
Remove two major causes of death in America.
Wow.
So I, in November last year, make it mandatory that every single one of my patients take K. And in fact, I then talk to myself a little bit, ask myself a question, maybe that's why some women, despite taking vitamin D, calcium, magnesium, estrogen, still get osteoporosis. I have that group of patients.
Still
And I say, yeah,
that are still taking all of that.
yeah, because in the old concept was they are osteoporotic. Osteoporosis can be reversed or prevented or reversed by taking D, vitamin, calcium, estrogen, right? I mean, you heard about that.
Sure.
Yeah, yeah. But no, a lot of women still get osteoporosis, despite compliant on taking all those supplements. Suddenly, in my brain, it clicked. It could be the vitamin K deficiency.
Yeah.
Okay. Now, vitamin K, there are several kinds, and there's K1 and K2. Okay, and the reason both does this miracle. Both of them does this miracle. The only problem is K1 doesn't get absorbed easily. Only if I give it 1 milligram, only 10% gets absorbed, whereas vitamin K2 is all absorbed.
Oh boy. Okay. Good.
So that's why I chose vitamin K2. There are some capsules on the market of vitamin K1. It's not they're wrong. It's just that less of them are being absorbed. So why would I carry a product when I can carry a product that's absorbed 100% versus one that's absorbed 10%? So I choose to carry K2 in my practice. You know, we compound that.
So now you've only been prescribing it now. If you're just watching this, we were shooting it at the end of October 2016.
Yes.
So it's only been a year.
Yes.
Have you been able to track any results yet, or is it just a
No,
little
I have not
too
been
soon?
able. Yeah, too soon. Yes,
Yeah.
but I trust those studies that's done by many universities, medical centers in U.S., both U.S. and Japan, and it's it's obvious.
Because I mean, we've talked off camera here before. My mom was she had osteoporosis and she had the fractures, and there was I heard the stories of just take the vitamin D, take the magnesium, and
exactly.
to help. Nothing seemed to change,
See?
right? So this vitamin K, not only does it reverses
the osteoporosis.
Wow, that's amazing. So it adds to bone strength.
Yes.
I'm thinking that's pretty significant for people that are going through that maybe they're taking something for cancer that tends to rob them of their bone strength. I mean that I'm asking, this is way off topic, but is that something that they can take for
anybody with bone problem, osteopenia, osteoporosis, bone density problem should be on vitamin K2.
Wow.
It has its own independent way of restoring bone density, different from D, calcium, and every other mechanism.
And this is not a. I think you've mentioned before. There's water soluble or fat soluble type of vitamins. Is this something that you can?
This is water soluble.
So you can't overtake.
No,
this.
no,
you just
cannot.
Yeah.
My capsules are 250 milligram to a microgram per capsule, but there's no upper limit.
Okay.
The studies show that there's no upper limit. There's no toxicity level.
Wow, that's great news.
The 250 microgram just come out as a therapeutic level, meaning at that level we see results.
Okay.
So that's where we stay, not because it's toxic. Yeah.
Okay.
So at 250 microgram we already see results, and so we stay at 250 microgram.
So this is a standalone item. That's not in your multivitamin.
No,
this is
it's
a standalone.
It's standalone
product.
because
Okay.
it's too much volume to put into my multiple vitamin. Already people are complaining that my multiple vitamin is like a rock, so big. Some of my patients have to blend it.
They are kind of big, but they work. You get used to it. It's worth it. Trust
Some
me.
people can't swallow. They say, doctor can't get swallow. I said, well, then blend it. Blend with your morning favorite juice.
There you go.
So many of my patients actually blend my multivitamin. And if I put my K into it, they'll scream.
So it's a standalone, and
Yeah.
so they take
Volume.
that every day.
They take it every day.
Every
yes.
day.
I take it every day myself too.
Fantastic.
Yeah.
What kind of things? What kind of feeling, or is there an awareness that they'll have?
No,
Like,
there's
just-
no awareness, unfortunately, other than your carotid ultrasound, which is there's a free carotid ultrasound being offered at one of the country clubs next week, and I'm going to register.
Ah.
It's just because I want ultrasound to be done by a third party, so that it's not my own. People don't trust me. I could lie,
Right.
or take somebody else's ultrasound and say it's mine. So I want another party to do my ultrasound. That's why I go out to have ultrasound done. So basically, I want to see if I have any plaques at all, which it shouldn't. Last time I didn't, and I like to do things like that. And so I encourage my patients to do carotid ultrasounds. And if you find a plaque, to take K2 and then repeat it in a year.
Wow.
I encourage them to do a bone density test, and if they are osteoporotic, all of my patients are K2, to repeat it. Same machine, same hospital next year. It has to be the same machine
Yeah.
to be accurate.
Yeah.
Yeah.
Keep the conditions the same. Well, this is exciting. This is like discovering something totally new. I mean,
Yes, this is exciting. In osteoporosis and arteriosclerotic plaques is a big problem, big health problem.
Yeah.
Yeah, yeah. I mean, actually, when a person live old enough, when they live to 110, what's their likely cause of death? Hip fracture, actually.
Yeah.
Hip fracture is a very common problem in elderly people. If they have the faculty together, they have the health together, boom, they fall, break a hip, they go to the hospital, and they never walk again.
Yeah.
Because the broken hip cannot, even if they put in pins and rods, it cannot hold. You cannot, the nails and the plates cannot hold on a wood that is parodic.
Yeah.
So you can't hold together with nails when the wood is so frail.
Right.
Right. So the surgery usually is not helpful, and then they cannot walk. And they stay in the hospital, they go to the nursing home, and they stay in bed, they get an infection because of bed ulcers, and they get pneumonia and they die from that. So sometimes they get fracture, and the fat embolism, the fat in the bone marrow goes into the lung, and they die from pulmonary embolism. So very unfortunately, many healthy elderly people living the full to 100, 110 die from a fall, just a simple fall.
Yeah.
Not from a disease.
And we hear them dying of pneumonia.
Or blood clot,
But when we
pulmonary
go
embolism.
back, when we go back, that's what
When we go
happened.
back.
Yeah. So, here's one of the things I like about you, Dr. Chein, is the fact that, once you discovered the way hormones affect the aging process, you didn't just sit back on your laurels and say, okay, here we are, this is it.
No,
You just keep pushing the envelope. You keep
Yes.
discovering and finding stuff. And I can't thank you enough for sharing the K vitamin K story
Yes.
and understanding there's K1, K2, and you're saying K2 we get 100% absorption.
Yes.
K1 is about 10%.
10%.
Not that either one do anything different, except why would you take one that only give you 10% of the
Exactly.
absorption? So,
And there are products out there, K1.
Yeah.
So it's okay.
Yeah.
You know, if you're okay with 10% absorption, it's okay.
and you can get all of this either on your website or on Amazon.
Yes,
Right.
it's all over. It's non-prescriptional. It's OTC
Yeah.
product.
So it's over the counter, so you don't have a prescription.
No.
But you can get it on your website
Yes.
or through you on Palm Springs Life Extension Institute at
Yes.
Amazon.
Yes.
Well, Dr. Chein, thank you so much for sharing the K2 story. And thanks for joining us on another, I think, exciting episode of Living to 120 and Beyond. I'm Jeff Harrison. I'm here with...
Dr. Edmund Chein.
Thanks for joining us. See you again next time.